My name is Sydney Little, and I'm going to be presenting my occupation-based kit called Gone Fishing. The occupation-based kit was designed for a 74-year-old male in a skilled nursing facility. The client had a diagnosis of a cerebral vascular accident, and due to this CVA, the client has upper extremity motor deficits, including fine motor coordination deficits, and also dynamic and static balance issues. Some of the client's hobbies are fishing and hunting. The client feels a loss of a role of being a fisherman since his cerebral vascular accident. Some of the goals for therapy include improving ADL performance such as dressing, bathing, toileting, personal hygiene and grooming, and feeding, improving overall upper extremity weakness and fine motor coordination, increasing standing balance to increase participation in ADLs, and the client goal for this PICO presentation is to improve ADL performance. Okay, Tyler, to start off with, you're going to use your right hand, you're going to take one object, and you're going to reach as far as you can over here with your right hand. You're going to empty out this compartment. Once you're done, you're going to use your left hand over here and do the same thing, empty out this compartment one at a time. And then you are going to empty out all the compartments alternating between right and left hands. In response to my clinical question, the results of my literature are in favor of occupation-based interventions being effective in improving ADL performance. It was found that interventions based off of the Canadian Occupational Performance Measure that look at areas such as self-care, leisure, and productivity, and that are meaningful to the client can be used for interventions to increase occupational performance. Intervention examples such as woodworking and scrapbooking were used. It was also found that occupation-based interventions are useful in adapting to the unique needs of a client with a neurological disease to increase ADL performance. Occupation-based interventions can cause an increase in self-perceived performance and satisfaction with tasks that equate to an increase in actual occupational performance in clients who have been diagnosed with a stroke. Such interventions surrounding self-care, leisure, and home management were used in the studies. It was also shown that engagement from clients is greater when interventions are occupation-based and they embed items that the client holds meaningful. A majority of the evidence-based practice said to use client-centered occupations that were meaningful to enhance occupational performance. The client holds being a fisherman as one of his valued occupations. Best practice shows that if the client finds it more meaningful, it will increase participation and motivation, which in turn will increase occupational performance in ADLs. Through clinical reasoning, it is to be assumed that fishing activities would have been a valued priority for my client. Following best practice through the use of leisure, the client can work on skills that can help increase ADL performance. I also integrated best practice by embedding occupational items that are meaningful to the client that have been shown to create smoother, higher quality movements in less time, leading to an increase in occupational performance. I took items that may be more meaningful to the client, like a tackle box, lure, and bobbers as tools for the kit. I chose this kit because the client values being an outdoorsman. The client talked frequently about his love for fishing and how he wishes he could still resume this valued leisure occupation. The client would often talk about how he did not want to participate in therapy sessions because he was bored or not interested in the tools that were laid out for him. I wanted to engage the client in one of his valued occupations that was tailored towards his interests and also helped to increase ADL performance. This relates to occupational performance for the client because one of the client's main goals is to improve upon upper extremity strength and fine motor coordination to improve ADL performance. The client can use this kit to reach, grasp, lift, and move the bobbers and lures to work on his strength in a fun, occupational-based way. The client is working on fine motor coordination, which will help improve ADLs such as dressing, buttoning and unbuttoning, holding a comb, silverware, washcloth, or toothbrush. The client is also working on range of motion with reaching tasks, which will help the client when donning and doffing a shirt or pants or during bathing and toileting activities. When implementing this kit for the first time, I realized I had to make a couple changes. I was originally going to start off with the bobbers and lures outside of the kit and have the client place them in, but I realized that the client should be able to reach in and use more fine motor coordination and take them out. And I also realized that to grade this up, the client can perform this standing to engage in functional balance.